people who are hospitalized with COVID and who go to hospital, when they get into the system, it's like they're going to avoid, because everyone is pressured. You can't get any information out. But what complicates it is that a lot of the hospitals don't have Wi-Fi. And there has been a call from some health professionals and NGOs and NPOs that hospitals, particularly all these temporary facilities, must have Wi-Fi so that families are then able to be in contact, and you don't place an extra burden on the health professional, the health worker that often uses their phone to allow families to make contact with each other to do so. So I think part of pushing for this campaign around the price of data and making data more accessible is so much more necessary now, because it is often the way in which people can finally say goodbye in some kind of dignified way before they pass on, because they're literally not going to come out, you know, on the other side. I'm not sure how many of you have read the story in Becky Sisa, the South African Health Journalism Institute. They wrote the story about this family whose you know, person went into the hospital, and they just couldn't get any information on them because everyone was so busy. And it wasn't even a state hospital, it was a private hospital. But also people didn't have data, so they weren't able to connect them if they weren't at the phone at. And it then turned out that it was Sheikh Nazim, who is quite a big figure and the head of the Azavia Institute in Cape Town, quite a well-known mosque. And his family, despite the fact that they were quite privileged, couldn't access him because the people working in the hospital didn't have access to data to be able to tell the family what's going on with him whilst he was, you know, in ICU. And his family eventually had to fetch his body from the hospital, and without being able to say goodbye, without being able to part. And I think that's part of one of the things that has also come out here for me. Several organizations have you know, done the clapping for health workers, the kind of, you know, and it's good to show solidarity. But in many ways, you can actually empower them by giving them data so that they can have facilities that they can access to deal with their own trauma, deal with the double threat that they face, because there aren't spaces for them between the hospitals and their families to go and live for that period that they work in the hospital, like you see in other countries. And having data could put your family in touch with you in ways that requires you not to meet. And it's really become, data has really become as necessary as sustenance. It used to be seen as a middle class issue, as a luxury. And it's actually an absolute essential, because we're fighting a disease that compels us to not be in the same place with each other. So I think also just the messaging of this campaign for me must be that data isn't a luxury. It is not a middle class demand. It is actually an essential to be able to function in the world as it currently exists.